And now, Living Well with LDS Hospital.
I don't know how many moms out there are like I am, but when it comes to my kids having a cough, having some sort of a sickness, I don't want to be the boy who cried wolf. I don't want to take them into the doctor for every little thing. Sometimes I turn to the internet instead of turning to an actual medical professional. But luckily we have Shamar Lejardi today. She'll be with us from LDS Hospital. She is the nurse manager. Can you tell us when we should be calling the doctor, when we should be reaching out and getting advice from someone maybe a little more qualified than the internet?
Yeah, so it's important to know that moms know their babies best, no matter what. So if there's any overall change in temperament or activity, they're sleeping more than they usually do, they're not eating as well, they're irritable, you can't console them when they're irritable, those are signs. That's how your baby's telling you that they don't feel well. So call your doctor.
Call your doctor.
Yeah.
Okay, so what signs should we be looking for if we just need to just take them to the emergency room? Don't even think about it, just go.
Yeah. Immediate care is any kind of dusky or blue color around their lips and under their eyes is where you'll see it most significantly.
And this is specifically in newborns?
Yeah,
okay.
Up to about 2 months.
Up to about 2 months, okay.
Yeah. And if they're really working hard to breathe, so if their chest is sinking in and you can see their ribs, you need to go to the emergency room. And if they're vomiting or have excessive diarrhea, especially if you see mucus or bloody or green color, you want to get emergent care.
My sister just had a baby, and she actually had to keep her in the NICU for like a week. And as a mom, it's so nerve-wracking, but she had an infection, and I mean, she's fine. She was a little jaundiced and stuff, but my sister was, I mean, it's so scary when you have a newborn, and it's like, what's wrong? I mean...
Well, and this is your sister's first, and
yeah,
I feel like even with every baby that comes along, you kind of forget that first couple of weeks. What's normal? What's not normal? So it's important to find all of those different tips. What are signs of infection or illness we should be looking for?
So, again, that temperament or changes in eating or sleeping, any sudden change in their bowel movements, especially combined with their irritability or poor eating, is a sign of infection. And baby's temperature, if you feel like something's not right and you take a baby's temperature, the right range is...
This is so important to know, moms. Listen to this. I always want to know, what is the right range?
It's 97.7 to 99.9 Fahrenheit. So not all babies will present with a fever.
Interesting.
So sometimes they'll be lower. So if it's below or above that, you want to call your doctor.
Yeah, you wouldn't think that below you should call to. You think if it's getting too high.
My room's cold.
Well, I think it's interesting. My sister had her baby the same week that your sister did, and they had a really hard time with the bilirubin levels. I think that's something I've had affect half my kids at home too. Bilirubin, so it makes them jaundiced.
Yes, the yellow color
and they have to have the lights. So what are things you should be looking for as a mom at home to see if your kid has jaundice?
Mostly it's that yellow coloring. Sometimes their eyes will turn a yellow color, and they'll be lethargic. They'll be more tired, and that's a sign of you want to call your doctor to see if they're bilirubin.
That's always tricky when they're newborns because you think maybe they're
sleep all the
supposed
time.
to be tired.
And what about skin conditions? Anything that you should be looking for, and like, is it just coloration? Yeah,
mostly if they're pale or mottled is a sign of infection.
Okay.
The yellowing could be a sign of the bilirubin. They need to call your doctor. Often babies too, they won't eat as well. They'll have what we call thrush, which is a yeast infection in their mouth, and that will look like a white or gray bumps in their mouth, almost like dried milk. And they won't eat as well because it's not comfortable for them to eat. So you want to call your doctor. It's easily treatable.
Okay, so tell us as a medical professional, all the moms out there that are nervous about bugging the doctor, nervous about looking like a too overreactive mother, what is your advice to them if they're debating calling or not?
It's okay to call your doctor if you're concerned about any health condition, even something that we haven't talked about here today.
If in doubt, don't.
Okay, thank you so much,
You're
Shamar,
welcome.
for being
Thank
here.
you.
All of this information and more will be on LDS Hospital's website, also linked from our website as well.